Ms. Harris, the director of the World Health Organization for Europe, Dr. Hans Kluge, has put Macedonia as one of the 11 countries who have resurgence in new cases. Is this assumption based on the new cases or on the death toll? And also, Macedonia is painted dark on the map of the World Health Organization for the death rate. So my question is, by which parameters do you measure the mortality in the countries?
So when we talk about resurgence, we're talking about new cases. So this gives you an idea of what the transmission rate in a country is. And this is something we are seeing throughout Europe because when you've got large amounts of transmission in any country, it's likely to be in every country. So a lot of people, after they've come out of their lockdowns, out of their physical distancing measures, have not understood that people have often thought it's over, they go back to normal. This is not the time to go back to normal. We have to find a new normal. Now, different countries count their deaths in different ways. So we don't necessarily look at the death rate as, we look at the death rate as important because this tells you what's happening in your population, but it's not wise to compare yourself with other countries because every country does things a little differently.
The World Health Organization is being criticized for mishandling the world pandemic. How do you respond to this, and should the organization have declared the pandemic earlier?
So we did declare the public health emergency of international concern at the end of January. And as I'm sure you know, we were first notified of cases of a mysterious new illness in China at the beginning of January. So within 30 days, we had recognized that there was potentially a very serious World Health emergency, and we declared it, even though at that time we only had a few cases outside of China. But we saw that the potential, the risk was there to all countries. Now, one of the confusions is the term pandemic is something that's applied to describe the epidemiology. And the epidemiology had not really changed to the pandemic status until March. But the emergency was declared in January. And so we definitely told the world, but not everyone in the world saw the emergency the way we did.
The organization has made conflicting statements about certain topics in battling the coronavirus. For example, the wearing of masks and the transmission of the virus. Also, it has praised the Swedish model for handling the virus, which had turned out not to be so great.
So when our statements change, they change based on the science. And one of the important things about science simply means knowledge. When you've got something completely unknown, your knowledge is when you often look at something that's similar. So our knowledge of what this virus was likely to do was based on what we knew about it, the family of viruses it came from, its cousins, MERS and SARS. So the first advice we gave was exactly the same advice we gave for MERS and SARS. Now, as the science has evolved and we've looked at the different ways and the things that work, we say now, for instance, that when you're in a very confined space and you can't physically distance from people, it is wise to wear a mask. So we have moved to that because of the realities, the things that the way people have to live and the way we all have to now learn to live to protect ourselves from this virus.
And the Swedish model, it was previously praised as a good model for handling the virus, but it turned out to not be so great.
We have not specifically praised any particular model. We have always said what every country must do is test, track, find everybody who's infected, trace everybody who's infected, get those who are ill to care, isolate anybody who's in contact, and ensure that your community understands the things they need to do to protect themselves, the hand washing, the not touching their mouth, nose, and eyes, the physical distancing. That's what we've asked every country to do.
What can we expect several months from now on the fall? There is speculation about the second wave of the virus.
So this is a bit of a confusion. People think that they're following the influenza lens. They're thinking that it's a seasonal virus. Now, if you look at where you've got huge outbreaks going on, they're in countries that are equatorial, the countries where they don't have summer and winter. They are warm all the time round. So don't think it's about a season. It's about our behavior. Now, in Europe, of course, when it gets very cold, we are more likely to be indoors. And that's when we're closer together. That's when the ventilation isn't so good. So we're much more likely to catch a respiratory virus like that from each other. So that's why you may see an increase